Joining us now is 60 Minutes correspondent and CBS News senior political analyst John Dickerson. John, it's so good to be able to talk to you because this comes at such a critical time. This illness by the president, really the most serious health crisis since Ronald Reagan was shot in 1981. Put it all in perspective for us.
Well, it's such a critical time, Nora, because the stakes are so high. We've got 32 days till the election. The president has been encouraging his supporters to believe that the democratic system of elections is rigged. The pandemic continues, and there's a Supreme Court nomination. All of those things charge the atmosphere with explosive particles, and there aren't a lot of calming voices around, including adversaries of the United States who are circling around trying to sow mischief. One good thing about this has been a reassertion of a bipartisan care for the president, and there's been all that well-wishing that we've been reporting about tonight, but that doesn't mean the election has been repealed, which means when the president returns to the campaign trail, which is expected, when he returns, the pandemic will have been at the center of the conversation. He had spent all of his previous time trying to get the conversation on something else because the public has not felt like he's done a good job on the pandemic. Now it's very likely to be the dominant theme for the next several weeks, if not all the way till Election Day.
It's an excellent point, and I know you've written a book about the presidency, a bestseller. Is the White House prepared for this? And also, is the president's health a private matter? Should the White House be giving us more information?
The president's health is a private matter, but that privacy screen is small, and it gets pushed to the side when the president's private health conflicts with his public duty to keep the country safe. And it's up to the president's staff, because presidents sometimes don't want to inform the public. It's up to his staff to keep the national interest in mind. There are protocols to handle these kinds of things and to handle the transfer of power if that should happen. But there's a bigger stress test the White House is going through. And that's not just to handle the to-do list, but all the things that will happen while the president is incapacitated, if that becomes the case.
John Dickerson, thank you.